get a sign language interpreter, not your family, not your friend. Sign language. So people out there, I know it is difficult to get sign language interpreters. The number of sign language interpreters are not enough, but we are making efforts, and I believe Malaysian Federation of the Deaf, My Asli, there are a couple of other groups out there as well are training interpreters. Okay, perhaps a list of these people in all the hospitals who you can reach. These are the few things that I would like to say. And the question on the pharmacists, we have done a study, a survey with community pharmacists, but I understand that question was to hospital pharmacists. I don't know how relatable this is, but the majority of deaf people say that, again, a lot of them are communicate with written text. They said that even if you have images, like for example, when you go and visit a pharmacist and during consultation, they tell you that they will write down dosage, but even writing down is not right. If you have little posters in your pharmacy to guide or to help the deaf individuals to understand their medications better. Any guide, any help, like if you have a deaf individual coming in, open up a website, open up an app. There are many apps out there from America, from different countries that would help you communicate. Although it's not Malaysian Sign Language, but there is a sign language. So make some effort to draw in these people, like what Anthony said, show them that you care. I hope Anthony can add on to this, but from my knowledge, some of the things that as a healthcare practitioner you can do is to learn a little bit about the Malaysian deaf culture. For instance, some examples would be when you have a deaf patient, if the person comes in by himself and expecting to communicate with the doctor with written text, it's absolutely important to have eye contact with the deaf patient. Facial expressions are very important. They look at the facial expressions. And if you have an interpreter, or if you have someone who's going to be interpreting for you, as a medical personnel, don't look at the interpreter. I know we tend to do that, but look at the deaf person, but listen to the interpreter, because it's important for them to see your face, to see your expression. And the other thing is, during healthcare consultation, sometimes there is external noises and all that. So the healthcare, and you tend to move around and turn around, or you do other things, and it disrupts the deaf individual. So it is very important that you tell them, like if you're moving away to do something, you tell them that I am doing something, which is interpreted to them. So they need to know this. And there are a lot of things. The other thing is touching is acceptable for them. For example, you need to get their attention. You can tap them at the side. There are lots of other things which you can do. You need to understand that when you communicate with a deaf person, it is not a direct answer. It is not direct communication. They tend to talk about a lot of things, so you need to understand where they're coming from as well. Okay? So these are some of the things that I can think of. Perhaps Anthony can add on to some of the other aspects of what a healthcare practitioner need to look out for to understand deaf culture.
Dr. Anthony, would you like to add? Go ahead.
Okay, in my opinion, the most important thing is the attitude and the heart and the openness of our medical people. Of course, try to learn something new. From my experience, when I go and see, when I go to the hospital, I think I would go like every month to the hospital for my follow-up sessions, and when I meet the doctor, I first see the face. And sometimes they would just call my name, and of course there's no response from me. So I hope the medical personnel, I mean the front counter, would recognize me because I go there every month. So they should know that I'm deaf instead of shouting and shouting my name. So this is one attitude that you can change, because it's a known fact that I can't hear. So why would they shout and shout my name every month?